Welcome back, welcome back. Hello, welcome back. Sorry guys, sorry about that. TikTok won't let me do that kind of labeling. Sorry. Blame TikTok. So we'll just have to move on to questions. Thanks for liking the live, thanks for joining back. I'm so sorry about that, guys. But the reason being that it is some flashcards that I have, but apparently I cannot use. I thought I could. I thought I got permission for that, but I guess I didn't. So I'm sorry about that. But we'll go over just some of the I had practice questions ready. Yeah, thank you. You're welcome. Yeah, it's really weird. I guess thanks for following. I appreciate it, Huckleberry. Basically, it's just like, for whatever reason, TikTok will end my live. Said it was gonna end my live in like 5 minutes. So what question am I on? If you were just in the other live, I had to restart because TikTok was making me end my live in a minute because I was using like flashcards and they were gonna end my live in a minute anyway. And I wouldn't be able to go live again for another 10 days. So I had to end the live and switch over to these questions, so that's why. So we're just on question 1 for now. So really sorry about that. But we're still going to do some of these practice questions anyway. No, I don't know. I guess because they were suggesting I was promoting a product, which someone said, where did I get it? So I say, you can go to Amazon. So I guess you can't really promote a product on a live. So that's probably why, unfortunately. I wasn't trying to. I was just trying to help help practice labeling. That was like the easiest thing for me to get together a little quickly for a live. So, but anyway, we're on question 1 here. You guys are already answering that, so I'll go over the question. What is the primary function of the skeletal system? And that would be B. That would be support and protection. Number 2 here. What type of tissue makes up the majority of the skeletal system? I'll give you guys a couple seconds to answer that. What type of tissue makes up the majority of the skeletal system? Alright, and the answer for that is going to be B. It is going to be connective tissue. Alrighty, moving on now. How many bones are in the adult human body? If you're just joining, thanks for joining. We're doing some skeletal system, anatomy, and physiology practice questions. B. Awesome, guys. Awesome. It is 206B. All right, number 4. Which of the following is a long bone? Which of the following is classified as a long bone? For whoever just asked about tips for anatomy practicals, I do have a video on my profile, so we're doing practice questions right now, but I would definitely refer to that video. It's not too far down. I think it's relatively pretty new. But number 4 is C, the femur. And we're moving on to number 5 now. Ooh, hold on, some of your guys's. I just took this test last week. Gotcha. The axial skeleton consists of. Let's go for number 5. We're moving on to number 5 now. I'll give you guys a couple seconds to answer that one. All right, number 5. Number 5 is B again. The skull vertebral column and the thoracic cage. Moving on to number 6 here, we have which of the What is the hollow cavity inside long bones, which contain bone marrow called? Moving on to number 6 now. Number 6. Buenos dias. Hi, Naomi. How are you doing? We've moved on here to... Give you guys a couple seconds. The correct answer is the answer choice B, medullary cavity. Some people looks like they were a little confused. Did we need an explanation on that one? But if a long bone, if this is the shaft, there's this hollow center here. So a hollow cavity, so it's hollow. The medullary is hollow. This is more so a memorization question. So you have, this is where red plus yellow bone marrow are. The periosteum is part of the bone, but that's more so the layer. It's not the cavity. The medullary cavity is what is the cavity for that one. Hopefully that periosteum is the outer layer of it. Hopefully. This is just for fun. I don't really know what TikTok University is. I've been hearing about that. We can go over the blood calcium level topics after we do these questions here. I know there were some people asking for these questions initially, so we can go over that afterwards. But we can move on to number 7 now. Number 7, the hard, dense outer layer of the bone is called... So there's Can I answer these already? Marrow, cartilage, not true. Spongy or compact bone? For pink glitter, so the skeletal labeling, there was an issue with that. I wasn't able to do that because they deemed it as I was recommending a product and they were going to end my live, so I cannot do the labeling right now. I'll have to come up with something else for that. But moving on to number 8, what type of bone cell was responsible for breaking down bone? Breaking down bone. Give you guys a couple more seconds here. Number 8 is B. A good way to remember this is clast, is cleave, and blast is build. Number 9. We're going to number 9 now, guys. Number 9, the bones of the wrist are called... We're number 9 now. Let me give you guys a couple seconds while we answer that. Thanks for joining the live. Thanks for liking the live. Thanks for sharing the live. Just trying to help as many people out as possible. Carpals is correct. Alrighty, moving on to number 10 now. The vertebrae and the neck region is called... Give you guys a couple seconds to answer that one. The bones, or the vertebrae in the neck region is called the cervical. Awesome. We can go over blood through the heart afterwards. If you guys have any questions outside of the skeletal system today, you'll have to wait till the end of the question, or end of the practice questions. We have 30 here, so. All right, moving on to number 11. The soft spots on newborn skull are called what? An osteocyte, I'll put it in here. Is a mature bone cell. And then the answer here is fontanelles for number 11. B. Answer choice B. They're gonna be on my Instagram afterwards. I did some yesterday. I haven't posted them yet, so I'm gonna do that right after this. I got a little busy last night. Moving on to number 12. Which type of joint is found in the shoulder? What type of joint is found in the shoulder? Give you guys a couple seconds to answer this one. It is B. It is a ball and socket joint. Alrighty, moving on to number 13 here. Which of the following bones is not part of the appendicular skeleton? The scapula, the humerus, the sternum, or the pelvis? Which of the following is not part? I need a couple different answers here. I think we have axial versus appendicular. But the answer here is going to be C, the sternum. It is part of the axial skeleton. Remember that if you think about the ribs, this is my crappy drawing of a rib, but the sternum is part of the ribs, so are connected to the ribs. Number 14. What type of cartilage is found at the end of long bones in joints? Where did I get this layout? I made this myself. I made these questions myself. The layout, everything is myself as well. I try to scale it so that I have I make some easier questions, and then I make some kind of more difficult questions, and then I move on to harder questions. And I have some application-based questions as well if people are interested at the end of these 30 questions. Thanks for joining, everybody. If you're just joining, thanks for liking the live. I do a lot of anatomy and physiology content. A lot of practice questions. We try to go live every day. Thanks for the rose, Jazzy. Appreciate you. Thanks for following, guys. Thanks for following. I really appreciate you all. But number 14 here, I'm going to give you guys the answer. And the answer is hyaline cartilage. Alrighty. Number 15 here, the process of bone formation. Bone formation is called... the specific doc I ended up putting on my Instagram after the lives, so all you guys can have these afterwards. I had some questions from yesterday I haven't posted yet, so be looking for 3 posts from me today on Instagram. All right, you guys are killing it. The answer is ossification. I'll give you guys a great mnemonic for endochondral ossification real quick. I'll move on. It is boys can't... I'll let you guys look at the next question here. Can't pee during erections. This is bone collar formation. I'm just going to abbreviate. This is cavitation. This is where periosteo budding occurs. Plus spongy bone forms. This is diaphysis. Elongation, this is where the medullary cavity, I'm going to put elong. So this is where the medullary cavity forms, and erection is for the epiphysio. So this is where the epiphysio lines are closed now. That's where our cartilage are only there. How do I go live every day? Yes. Alrighty, what is the first cervical vertebrae that supports the skull? You guys have already been answering that, and the answer is B, Atlas. Could I send with the mnemonic? Yeah. Alrighty, and the number 17. Which of the following bones is not part of the skull? And that is C, the clavicle. I need A&P chapter. I do have notes for that on my website. Can I post this afterwards? Yeah, I do post this directly afterwards. Alrighty, moving on here. I'll leave this up here for just another second. You guys can take a look at it. I can go back to this a little later, but this is the mnemonic. Boys can't pee during erections. Moving on. 18. The longest and strongest bone in the body is... longest and strongest bone in the body is called... osteolysis is like just the process of breakdown of bone. The answer is C, femur. Moving on here, number 19. Which hormone increases blood calcium levels by stimulating osteoclast activity? Number 19 here. I'll give you guys a couple seconds to answer that one. If you're just joining, thanks for joining. Thanks for liking the live. Thanks for sharing the live. We're trying to get as many people help in anatomy and physiology as possible. Seen a couple different things here, but the answer is B. Parathyroid hormone. Yeah, here I can go over this one. So essentially here, parathyroid hormone, its like main role, obviously, is to increase calcium levels in the bloodstream, which there can be issues with that. That can lead to a lot of different pathologies. Give me 1 second. Do I have a YouTube channel? Yeah, I'm thinking about posting the recordings of these afterwards to YouTube. Let me know if you guys would be interested in that. Would be everybody, real quick, just aside from, I'm about to do the explanation here, but would everyone be interested in me posting the live recordings from TikTok to YouTube? Would people actually watch that? Is that worth the hard drive space on my computer to move it from TikTok to there? So parathyroid hormone is released in response to low calcium levels. What it does here to do this, to respond to it, it increases osteoclast activity. So when we break down bone, we release calcium into the bloodstream. And then we also increase calcium absorption in the intestines. And then we reduce calcium excretion from the kidneys. Does that answer the question for 19? Is that a good explanation? My YouTube is linked. I do have practice questions on my study guides, yes, but most of them are just like the notes. Okay, good. I'll post them then. I will put an announcement on my story on both Instagram and TikTok about that when I get those up. Is this a part of homeostasis? Yes, this is technically considered homeostasis. I'll thank you for the gift, Diana. Thank you so much. That's too kind of you. I've actually never seen that one before. What is it, though? Like, looks like a scared heart face. Is that what that is? But I appreciate you. Thank you for the gift. I really appreciate it. You guys are awesome. Took me a minute to find. Yeah, it's the same as my TikTok username. Sorry, I don't really have a lot of people on my Instagram right now. I'm moving on to number 20. Was everyone good on number 19? Was that a good explanation as to why? Was that a good explanation as to why? 20. 20. 20. 20. 20. 20. 20. 20. 20. 20. 20. 20. 20. 20. 20. 20. 20. 20. 20. 20. 20. 20. 20. 20. 20. 20. 20. 20. 20. 20. 20. 20. 20. 20. 20. 20. 20. 20. 20. 20. 20. 20. 20. 20. 20. 20. 20. 20. 20. 20. 20. 20. 20. 20. 20. 20. 20. 20. 20. 20. 20. 20. 20. 20. 20. 20. 20. 20. 20. 20. 20. 20. 20. 20. 20. 20. 20. 20. 20. 20. 20. 20. 20. 20. 20. 20. 20. 20. 20. 20. 20. 20. 20. 20. 20. 20. 20. 20. 20. 20. 20. 20. 20. 20. 20. 20. 20. 20. 20. 20. 20. 20. 20. 20. 20. 20. 20. 20. Welcome. Thank you for what you do. Yeah, no problem. Thank you for joining and everything. I really appreciate it. I couldn't do this without you guys. You guys are too kind. I'm in surgical tech, and this helps. Great. I'm glad this is helping. Thank you for the rose, Angie. I really appreciate you. Why was this kind of formatted? I actually haven't looked at teas, but I do if I was planning on doing teas practice test eventually here. I don't really have any. I mean, anatomy is on the teas, but I was thinking about doing that if people were interested. I've gotten a few things interested. I've just been working on it. So low calcium levels can be caused by a couple things. So low calcium can be caused by hypoparathyroidism, which is not enough parathyroid hormone, vitamin D deficiencies, chronic kidney disease, things like that. Pancreatitis, liver disease. There's a lot of different things. There's a whole lot of calcium pathophysiology. It's kind of intense. But anyway, moving on to number 20 here. Some of you guys have already been answering that, so I'll just go ahead and give the answer here. Thank you for answering the question, guys. I really appreciate the participation. But anyway, 20 is what a fracture where the bone breaks, but it does not completely penetrate the skin. It's called a simple or closed fracture. So it's D. All right, moving on here. 21, the patella is an example of what kind of bone? Thanks for liking and sharing the live, guys. I really appreciate you. Awesome, you guys are killing it. The answer is C, correct. Based off these, I really need help. Let me know if you need any videos made or anything. I'll post this to YouTube afterwards, I suppose, then. So many people have mentioned they were interested in it, so. But 22 asks, which part of bone is responsible for longitudinal growth? Give you guys a couple seconds to answer that one. Are you Eastern time? Yes, I'm Eastern Standard Time. Give you guys a couple more seconds. I'm seeing a couple different answers here. I might go ahead and explain this one just because I'm seeing a couple different answers. Explain. Okay. Yeah, I will explain. Okay, so I'll go over the answer first. So, which part of the bone is responsible for longitudinal growth? This is the epiphyseal plate. So essentially, the epiphyseal plate is also known as the growth plate. It is a layer of cartilage, essentially. It's at the end, long bones. And it's responsible for longitudinal. It's what allows the bone to grow longitudinally. So during, whenever you're a kid, you have what are called chondrocytes. And these, during puberty and stuff, they multiply. So. And during this is what we mentioned earlier. This is endochondral. And during this is what we mentioned earlier. This is endochondral ossification. So it's just the growth plate here. These are not periosteum more so plays a role in widening the bone. So it's called appositional growth. And there's some repair in there as well. The endosteum is the inner surface of bones. It's involved in bone remodeling, but not longitudinal growth. in the medullary cavity. This is just what contains bone marrow. So this is just like, let's just change contains to store. So this is for storage, bone marrow. Does that answer everyone's explanation? Is that good? This is a good review. Thank you. What are my study time? Sometimes I do it later in the day. Sometimes I do it in the morning. Tomorrow, I'll probably do it around 7 p.m. Eastern Standard Time. Real quick here before I move on. Thank you guys for following. Thanks for joining. Was that a good enough explanation for 22 before I move on? I do post on TikTok as well. I'm going to post these on YouTube afterwards if you guys want to subscribe to me on YouTube. It's linked in my bio. How did I enter here? God must knew I needed you. God must knew that I needed you too. Okay, we'll move on then. Number 23. What is the name of the canal that runs through the center of osteons in compact bone? Give you guys a couple seconds to answer there. My test has been postponed. Fantastic. God most definitely knew he needed you. God most definitely knew that I needed you guys as well. I don't think you guys realize how much you mean to me, genuinely. You guys make me so happy. I talk about you guys all the time. YouTube, please. Absolutely, yeah. I'll work on that like today, tomorrow-ish. Tease, I will probably do a tease practice test. Here soon. So, anyway. Alrighty, I'm going to give you guys the answer here. The answer is the Haversian Canal. Can I do skin? Yeah, I did some skin questions last night. So I'm going to post that to YouTube probably later today-ish, tomorrow-ish. I'll post an announcement on my TikTok story. So just be on the lookout for that. I'll probably also post a video about it too. But anyway, moving on. Thank you for the finger heart, Alyssa. I really appreciate you. I'm on the nervous system now. Can you go over it? We're doing the skeletal system as of right now because it's been requested. But I can do the nervous system either tomorrow during the live or anything like that. I'll take requests for tomorrow's live a little bit later. We're on number 24 now. The clavicle articulates with which part of the sternum? That would be amazing. Yeah, I can do that. If you'd like, Cynthia, for asking about the nervous system, just to remind me, also send me an email on my website, just whatever you'd like to see. In a live, I take requests there. I always look at my email, the live and emails. I always answer my email. Sometimes DMs, I'll be honest, sometimes people will spam just emojis at me or just randomly spam me with videos. But anyway, the answer to 24 is B, the manubrium. So sometimes I do miss DMs. So if you're looking to contact me, email is definitely the best way to go. Number 25 now. What structure allows osteocytes to communicate with each other? Give you guys a couple. Block the spammers. We need you. Yeah, I know. I try to. Especially if they don't follow me too, and I'm like, oh my goodness. I once woke up one day. I literally woke up. This was a couple weeks ago. I woke up and I kid you not, I had over the 99 plus notification. I had that from just direct messages. And I was like, holy crap, I guess people have a lot of questions. Nope. It was just some guy spamming me with videos that were irrelevant. And I was like, dang. I was like, come on, man. So that's why sometimes I miss them. But 25, the answer is the canicula. Letter B, choice B. Are we good on that one before we move on? We good with that one before we move on? Just going to make sure before we move on to the next question. Yes, no. All right, I can do... Did we want an explanation on it? Okay. Yeah, I can do a quick explanation. This is more so, I would definitely recommend, if you're having trouble with this question, I think you should make some flashcards for these, because they do have different functions. So the lacunae are just the small cavities where osteocytes are, so they contain osteocytes. The caniculi are the channels, so these are channels. So most channels are for communicating. So like think of like a radio channel. So if you know this is a channel, like think of radio channel. And they communicate at gap junctions. And then Haversian canals. These are the large like central canals for compact bone. So this is what has blood vessels and nerves. Trabeculae are irregular bony structures in spongy bone. So these are for support, not communication. Alrighty, moving on to number 20s. Was that good on? I'll leave these up just for a second, but I would definitely recommend if you missed this question, for these 4 answer choices, just because these are part of the bone tissue anatomy, make some flashcards for these and go over them. Number 26, the zygomatic bone is commonly referred to as, which, if you know, this is my favorite facial bone. If you were wondering. Give you guys a couple more seconds to answer that. Hey, the cheekbone. I just think it's like the funniest thing ever. I don't know why. I've just thought zygomatic is like just a cool name in general. But anyway, number 27 here. Looking at which of the following bones contributes to the foramen of the nasal septum. Give you guys a couple seconds to answer that one. I believe. Let me move this here. Which of the following bones contributes to the formation of the nasal septum? Alrighty, good job, guys. The answer to that one is B. Thanks for following, guys. Boomer. I am no boomer. I'm a young man. Alright, last 3 questions here, and then I can potentially bring in some more questions here. Application-based questions, if you'd like. Alright, essentially here. My bad. No, I am no boomer. I am Gen Z. I believe that's my generation. I need help streaming this to my TV. Is it possible to show with this bone? I don't have one currently, and that's mainly because of TikTok, actually. I wish I could show pictures. I don't know why I got flagged. I gotta look into that. I'll do a labeling practice here in just a second. But anyway, number 28. Which type of joint movement increases the angle between 2 bones? This is from Anatomy and Physiology. This is centered around like undergraduate level Anatomy and Physiology, so it's pre-nursing, pre-med, exercise science. Give you guys a couple seconds. The answer here is going to be B, extension. You said a brand name, the A word. I'm confused. All right, well, moving on. Number 29. A foramen is a. So it should be a little easier. What notebook app am I using? I am using GoodNotes. But it is a hole in bone for passage of nerves and blood vessels. How is abduction not correct? So I'll go back to number 28 real quick. So flexion, extension, abduction, and rotation. So this is Let me try to think how to explain this in terms of like wording as opposed to. So you're increasing the angle. So this obviously decreases the angle. This is what moves. So abduction is what moves a limb away from the midline. So you would. So you would technically decrease. This is a movement where the bone like kind of like rotates, obviously, so it doesn't really necessarily do anything with that. Hopefully that answered the question there. I'm not too sure. The thing is, it moves away, but it does not increase the angle. It doesn't change a joint angle, so it's not moving any of the joint angles. That's kind of the reason. So if you're looking at what kind of joint movement increase between two bones, so this increases between two bones. So increase between bones. While this moves a limb away from the midline, it doesn't necessarily change a joint angle. That would increase bone separation, if that makes sense. It's kind of a trickier question in a way. Was that a good explanation? Or no? Just make sure I'm good before I go to the last question. Yes, extension is for joints and abduction is for a limb, so yes. We're all good before I moved on here. Last question. Thanks for following, guys. I really appreciate it. Thanks for liking the live. We went on to number 30 here. So the osteon is composed of concentric rings called what? And we went through this a little faster than I thought I would just because I didn't know that TikTok was going to block the labeling section, which is insane. The answer is C. I did endocrine system yesterday, so I'm going to post that to YouTube. So it'll be, if you want to subscribe to me on YouTube, the link to that is in my bio. I'm going to be posting that one there. I did some practice questions there. So we have finished the questions that I had planned because TikTok ruined the labeling. So would you guys like some application? So we did some like kind of moderately easier skeletal system questions here. Would we like to move to a different topic all around? I can make a couple more questions, or I do have some application-based skeletal questions. Would we like application-based? What would you guys like I can take this in whatever direction you guys want. I I cannot do labeling right now. No labeling because of TikTok. So yeah, I cannot do labeling, unfortunately. That is, I wish I could. It's not that I don't want to. I have to figure that out. Yes, they are more challenging. Seeing skeletal. Application-based. Tegumentary system. We did tegumentary system earlier. It's more application. All right. I'm seeing a little more application-based questions. So just give me 1 second. I just got to put them up on my iPad. I have 10 of these questions, and then we can move on to a different topic. I'm only doing this because I feel like I'm more inclined to do the skeletal system because I had more questions that I couldn't get through. So I do feel a little guilty in that regard. So we'll do some more questions from the skeletal system, and then I will move on. And I do see some people putting in the nervous system, so I will... I think tomorrow's live will be the nervous system. I've had a lot of questions about that, so I will probably do the nervous system tomorrow. And that'll be at... I'll go through two... I like to go through like 2 topics. So just send me an email or anything of any topic you'd like to see. So we'll do nervous system, and then we can also do a second chapter as well for practice questions. But the plan was to do skeletal system today. But just give me 1 second here. I'm just formatting it so that it can go on my iPad a little easier. So just bear with me for like just a minute here. But I do have like 10 questions for us. These were like some practice questions that I had made for some of my students before. Just a moment here. Sorry. Oops. Bear with me for just a couple more seconds, guys. I'm so sorry. We'll get started on these questions here any second now. All right. Alrighty. Alrighty. Alright, so these are application-based questions here. So you can go over some discussion. We'll explain some of these. We'll do the whole shebang here, so we can go through. These are more advanced. Do I upload these questions here? I'm gonna answer some of your questions real quick. When do I go live? Tomorrow's gonna be 7 p.m. Eastern Standard Time. What is a simplified book? Look on my website. I have recommendations on that one. It's the Exploring the Body Machine. Hour of your life, please, I need to study with you. It's going to be 7 p.m. These worksheets are going to be on my Instagram afterwards. When will I post these to YouTube? I'm going to work on getting that together today or tomorrow. I'll post on my story about that. Do I post study guides? Yes, I do. They're on my website. The link to that is in my... You can find that in my profile. Okay, ahora te conectas ahora 7 mañana. Example of simplified study guides for students. Yeah, I have simplified study guides on my website. Where can I find these worksheets? You can find them on my Instagram. They'll be posted afterwards. I forgot, I haven't gotten a chance to post the videos from yesterday from the ones, so those will be on there as well. So you can probably see my YouTube channel is it's linked in my bio for TikTok. Can I come teach your bio? I wish. I would love to. Yes, I have these simplified study guides for students, both anatomy and physiology. I have plenty of the study guides on my website that I use. They're exactly what I made and used and what I used to get an A in anatomy and physiology. So they are exact. Are we ready to start these questions, guys? I'll wait a couple seconds here. Are there any quick questions before we started this or anything else? Or yes, okay. Alrighty, so looking at here, a patient arrives at the hospital with a fractured femur. The X-ray shows the fracture extends through the epiphyseal plate. What is the most concerning potential consequence of this injury? I'll give you guys a couple seconds to answer that question. Give you guys a couple more seconds. But yes, the answer is B, yes. As remember, the epiphyseal plate is the growth plate. I've actually had an injury with that in my thumb. Actually, both of them. I fractured the growth plate in both of my thumbs, and I did that in 6th grade, so my thumbs are the same size as they were in 6th grade. Fun fact about me. But obviously increased bone density in the infected limb, not necessarily because it is fractured. Increased bone remodeling rate, not typically, especially in the epiphyseal plate. If it's going to be growth plate, it's not going to remodel as fast. Decreased risk of future fractures, that is not true. Anyway, moving on. Are we ready to move on to number 2, or do we need any more better explanations for these? What do we think? Give you guys a couple more seconds. Are we ready to move on to number 2? Thanks for joining the live, guys. Thanks for liking the live, and thanks for sharing it. I really appreciate it. We're just trying to get some help out to everybody who needs it for some anatomy and physiology. I know a lot of people have some exams coming up, especially the skeletal system. Alrighty. Number 2 here. 70-year-old woman falls and fractures her hip. Her bone density scan shows severe osteoporosis. What hormone is likely deficient? Delete that real quick. I did not post it. I'm going to post it directly after this live. I just didn't get a chance to last night. Number 2 is C, estrogen. Were we confused on that one, or do we want to move on? Are we good to move on? Can I explain this one? Yes. All right, so as we know, the correct answer is estrogen. So estrogen is very important for maintaining bone density. So I'm going to center this a little bit. It does so by inhibiting osteoclast activity. But you remember, osteoclast breaks down bone. So if we don't have estrogen, we're not able to inhibit osteoclast. Therefore, we have more bone breakdown. Inversely, we have increasing osteoblast activity. I'm just going to put act for activity. Which osteoblast builds bone. So if we lose estrogen, if we're deficient in estrogen, we don't have as much osteoblast activity. So with that, we have decreased osteoblast activity and increased osteoclast activity. So we have more bone breakdown than we do bone being built. And then it also increases calcium absorption and retention in bones. So if we're deficient in estrogen, we are decreasing the amount of calcium that's being absorbed and retained in bone. Testosterone does help maintain bone mass, but that's more so in men. Growth hormone is more so used during childhood and adolescence, so this wouldn't be for a 70-year-old woman. And then thyroxine or T4, that one is for it's a thyroid hormone, so that's going to regulate metabolism. It can lead to bone loss, but it's not necessarily correct there. All right, does that answer? Do I ever do A and P2 questions? Yes. Here's the answers to 1, 2. Okay, so do I ever do A and P2 questions? Yes. We're gonna probably do some A and P2 tomorrow, 7 p.m. Eastern Standard Time. Was everyone good on that explanation? Did that make sense? Did that explain why an estrogen deficiency would lead to severe osteoporosis? Did that help? Just want to make sure. So estrogen really affects bone structure in all forms, being broken down, built up, and retained. Yeah, most likely. I think I'm going to go over the nervous system and cardiovascular system tomorrow as of right now. Lily. But anyway, we'll move on to number 3 here. Feel free to ask a question while I do this. So for number 3 here, we have a weightlifter experiences severe shoulder pain after attempting to lift an excessively heavy weight. An MRI shows damage to the joint where the humerus meets the scapula. Which type of joint is most likely injured? Women have more estrogen, primarily for reproductive physiology and hormonal regulation. Estrogen is produced in ovaries, and the menstrual cycle regulates estrogen levels. The men produce small amounts of estrogen in the testes. It's converted through from testosterone in men. So testosterone is produced and it has to be converted through estrogen with aromatase enzymes. Did I answer your question, Alexandria? But number 3 is B. Interesting, thank you. Yeah, no problem. Okay, good, Alexandria. Just making sure. Alrighty, moving on. Were we good on number 3? Did we need an explanation? Are you guys ready to move on? Let me know if you guys are ready to move on or not. To number 4. Ready to move on. Gotcha. Alrighty, number 4 here. During a forensic investigation, a skeleton is found with a completely fused epiphyseal plate in the long bones. What does this indicate about the age of the individual? You can find these practice questions on my Instagram right afterwards. Give you guys a couple seconds. So we're talking about an epiphyseal plate here. Yes, the answer is C. The individual was an adult. So if you remember, in adulthood, more so like someone asked 25, or 21. It's typically at 25. This is the kind of given average for whenever bone. Most people are kind of their epiphyseal plate is completely fused. So if you're looking at an X-ray and you see that it's completely fused, you can assume that they are most likely 25 or above. Obviously, there's cases, but so if you're under the age of 25 and you're kind of concerned about your height, it's not over yet. You still got time, you know? I don't know if anyone's worried about that, but I'm 24, and maybe I potentially have some time, but it's been a couple years since I've grown, so who knows? Maybe I'll get a little taller here in the next couple months. Alrighty. Were we all good on that one there? So at 25, the epiphyseal plate is normally average. On average, at 25, the epiphyseal plate is completely fused. Are we ready to move on? Thanks for joining and following and liking the live, guys. I really appreciate it. I really appreciate the follows and everything. You guys are awesome. Yes. All right. I'm 34 and 5'2", and all hope is gone. I'm sorry about that, Jenny. That's rough. Potentially, if you're not the average, you never know. But on average, yeah, you're cooked. Number 5, a patient with chronic kidney disease has unusually soft bones. that are prone to fracture. This condition, known as osteomalacia, is likely caused by a deficiency in which critical bone-related substance? So this question, if you are a little confused with this question here, this question goes by just maybe making a flashcard or so for osteomalacia. You should know what osteomalacia is, what it's caused by, what is the result, and everything like that. I'm seeing a couple different answers here. I'll give you guys a couple more seconds, and then I'll probably just go over osteomalacia. Osteomalacia is in my chapter 6 notes. But I could see... give you guys a couple more seconds. So, the answer is C, vitamin D. So, osteomalacia... I'm going to explain, so give me 1 second. I saw a lot of people were putting B, parathyroid hormone. And while parathyroid hormone is responsible for calcium, so calcium deficiency, so osteomalacia is typically as a result of decreased calcium. Yes, true. But this is due to diet. It's not parathyroid hormone. Does that help answer the question there as to why that answer is the way it is? So this is something that you'd like to know. If you had trouble with this question, I definitely recommend making a flashcard for osteomalacia. So, oops, I keep hitting my thing. So sorry about that. I'm actually going to zoom out some more. But collagen is more linked to osteogenesis. Calcium-binding proteins help transport calcium, but their function... Hold on here. Is my live blur? Oh, I gotta do the stupid inactivity thing here. Okay, there we go. So calcium-binding proteins function based on vitamin D. So their function depends on vitamin D. So that's why a D was wrong. Collagen is more so for osteogenesis. Parathyroid hormone increases blood calcium levels. So the parathyroid hormone, so like I mentioned, it's calcium tubes more so that from diet, not parathyroid hormone. And then calcium-binding proteins function depends on vitamin D prevalence. So, all right, let me check the comments real quick before I move on, just to make sure. Is bro ever not taking anatomy? Hi, Dan. I'm always in anatomy. It's my job. Does that answer everyone's question? Can I explain osteomalacia? Yeah. So osteomalacia, I'm going to put this at the top here. It is characterized as bones are inadequately mineralizing. Which essentially just means that if we're not mineralizing, you're going to have soft, weak bones. The main symptom is pain with weight, and the causation decreased calcium in diet plus a vitamin D deficiency. Are we all good there? Easy bones fractures / breaks. Yep. You're right about that, Dan. Everyone good? Can we move on to number 6 now? I'll give you guys a couple seconds here, but I'm gonna read the next question here. I think that's all. That's pretty much all to talk about for that one. But a soccer player, how do you know it's vitamin D? What do you mean? How do I know it's vitamin D? Were you here for the explanation or no? But number 6, I'll move on to. Do I have study guides for the Hezi? Not currently. I will make one though, just because people have been asking for them. So I will probably get that together. All right, but number 6, a soccer player suffers a direct blow to the lower leg, resulting in pain, swelling, and an inability to bear weight. X-rays show a mid-shaft tibial fracture. What type of bone fracture is most concerning due to potential complications? Drink whole milk to help supplement vitamin D. Go outside and get some vitamin D. Dan. Dan's a good friend of mine. But Dan, go outside and get some vitamin D. That's what my mom used to make me do. Seeing some letter A's. I thought vitamin D was one. I'll give you guys a couple more seconds to answer that one. I don't know, maybe. Alright. Any more answers real quick before I give the answer? Anyone take a guess? I see some people saying. So let's go over this real quick. So a lot of people put A, and A is sort of correct, but it's not the best answer for this one. Well, yes, spiral fractures are the most common sports injury. The question asks, what is the most concerning due to the potential complications? So spiral fractures are not immediately dangerous as an open. So the answer here is a compound or open fracture, and this is due to the fact that open fractures have a lot of infection risk. They don't heal as fast, so delayed healing. And they also have a lot of potential for like neurovascular damage, things like that. Does that help answer that question? Did that explain why some people got the answer wrong? The question was more so concerned with not what type of fracture it most likely was. It was more so which type of fracture are they most concerned about it being because of the future potential complications, not what type of fracture is it most likely. Very tricky, yes. It is a very tricky question. That's why I think application-based questions are very good to practice, because it definitely makes you pay attention to the question, and whether a lot of your it is a very technical question. When in doubt, guess C. That is what you always say, Dan. It's a very technical question, I will admit. And it is tricky by putting a soccer player in here. I think potentially if soccer player wasn't in this answer, or it wasn't in the question, you guys probably would have got that one right. All right, I'll move on to number 7 now if we're all good. Are we all good on number 7? Are we all good to move to number 7? No response. Okay, yes. Alrighty, number 7 asks, a scientist is studying bone remodeling and observes increased osteoclast activity in a lab experiment. What condition could this process mimic if it occurs excessively in the human body? Kind of went over this a little bit in one of the questions earlier. I'll give you guys a couple seconds to answer this one. Couple more seconds. I am 100% sure what osteoporosis causes. The correct answer is A. So for Alexandria, you're not 100% sure what osteoporosis causes. So osteoporosis it's kind of like it's a grouping of diseases necessarily, but the big thing here is bone reabsorption outpaces bone deposit. So this is where you have like severe bone loss. So if it causes severe bone loss, bones are very fragile, things like that. Did that help at all? Before I move on to number 8. Are we all good to move on? So someone asked about Paget's disease here. So Paget's disease is excessive bone formation and breakdown. So there's like more so like a very high ratio of woven, like spongy to compact bone. So it's very there's decreased mineralization as a result, which weakens bone. So there's spotty, weak parts. All right, number 8, an astronaut returning from a year-long space mission is diagnosed with decreased bone mass. What is most likely the cause of his bone loss? Give you guys a couple more seconds to answer that one. Let's a little bit. C. Yes, that is correct. Alrighty, number 9. A child is diagnosed with rickets and shows bowing of the legs and weak bones. Which component of the skeletal system is most deficient in this case? It's a little bit trickier here. I'll give you guys a couple of seconds to answer this one. A couple different answer choices here. I'll give you guys a couple more seconds. But the answer here is C. Hydroxy, I can never say it. Calcium phosphate, essentially. So we'll go over this one just because I saw some people were getting it wrong. So rickets is a deficiency. So deficiency in vitamin D, calcium, and phosphate. Which this causes decreased mineralization. And the primary deficiency is this calcium phosphate, which is responsible for hardness plus strength. Did that help? Was that a good explanation? Like I said, so rickets is more so concerned with what happens when you have a deficiency in phosphate. It kind of just leads to in children it's rickets, and in adults it's osteomalacia. For the skeletal system, phosphate deficiency has issues in a lot of areas. But vitamin D deficiency reduces phosphate absorption, so vitamin D deficiency can contribute to that. Rickets only in children. Yeah, rickets is in children. Was that good? Was that a good explanation? Can I move on to number 10, or I just want to make sure that but they call it rickets is for children mainly because of like if there's a lack of mineralization, it affects their development. Alrighty, I'm going to move on to number 10, which is our last question here for the live. Number 10 is a 35-year-old male is diagnosed with a genetic disorder that causes excessive collagen production in bones, making them abnormally flexible. What condition is most likely responsible? I'll give you guys a couple seconds to answer this question here. Is my live back up now? I think my live went down because my phone got knocked off the battery. I got a low battery percentage. It's okay. Alright, I'll give you guys a couple more seconds. Okay, last good again. Any more? Did I read a lot as a kid? Yeah, I did. I read a lot now, too. I'm reading The Will of Many right now, if you'd like to know. I'm almost done with that book. Alright, I'm going to get the answer now. The answer is osteogenesis imperfecta. I did see there were some couple different answer choices here, so we'll go over that one real quick. Osteogenesis imperfecta. This is where it's a genetic disorder that results in defective collagen production. Mainly type 1, which is for bone strength. Osteopetrosis, this is excessive bone density, so increased bone density. Which is due to decreased osteoclast activity, which makes bones brittle as opposed to flexible. EDS, it does affect collagen, yes. However, it leads to hypermobile joints, not necessarily flexible bones. And then Marfan syndrome, this one here, this affects Fibrilin 1, which leads to longer limbs. And then joint hypermobility, but not excessive collagen production. Alrighty, so that's all the questions that I had for today's live. I will be live again tomorrow at 7 p.m. Eastern Standard Time. I'll probably do nervous plus cardio, phys. Are there any other quick questions here before I end the live? I really appreciate you guys for following, for joining, for liking the live, for participating. I really appreciate it. Or is there anything else that you'd like to see in the live tomorrow here? How many anatomy books have you read, or have you just learned this from the lectures? I've read a few. I've read from, can you do a blood live? Yeah, I could do it as part of, so I can include blood in there as well. You are my new best friend, thank you, yes. How long do I go live for? I go live for about like an hour or two. I'm going to start posting these to my YouTube. There's been some requests on that. So if you go to my account and go to my profile and go down to, I should have my YouTube linked. If you want to subscribe there, I'm going to figure out how to do that today. I need help labeling the bones. I'm going to need to look. Yeah, so I did actually have, I did have labeling practice today, but I got flagged on TikTok. So I'll figure something out for that. I will. Have you learned this from lectures? I've learned from lectures. Yeah, yeah, I'm so sorry. I was planning on doing labeling, but it would not let me. I'm so sorry about that. I've learned from textbooks, lectures. It looks like advanced. Yeah, these are some practice questions from my graduate school level anatomy. So these are some of the books. So this is exploring. If you look on my website and go to my recommendations, I have the books that I used. Gray's Anatomy. And Costanzo Physiology. These are my textbooks that I used on top of plus my undergrad plus grad lectures. And those are my study guides on my website. Yeah, I'm gonna just. So this is essentially where I get everything from. How do you not get bored when studying? I actually, I love this slide. My first time here. Thank you for joining. Yeah, I appreciate it. First time here. Thank you. Yeah, no, thank you for joining. I really appreciate you. I hope it really helped. Jasmine, I'll definitely try to figure out some labeling stuff. I got to look into, like, the like. So what happened was, I'll explain. I started the live earlier today, and I started going through it, and I got a notification that if I didn't end my live within the next minute, I was gonna get banned for 10 days because I was using flashcards. But apparently I can't do that. I looked into it and I thought I could, but I guess I can't. So I'll figure something out for that. How do I not get bored when I study? I love studying. I don't know. I've always liked. I love learning. These questions were challenging, very much needed. Yeah, I did some easier questions earlier in the live too. So I try to do like a little bit mix of both. I try to start the lives off with easier questions and then move into a little more challenging, nicher questions. And then if if time allows, I do use some of the application-based questions. Which some of them I try to make a little tricky so that you have to really pay attention to A, the question, and B, like know your definitions. But these are all my resources that I typically used. You can find them on my website again, like I mentioned. But these are the books I used while in the class. And then my lectures are what I made my study guides from that kind of have all these materials in it as well. Repeat, 7 p.m. Eastern Standard Time tomorrow. So for me, it's February 20th. I may potentially go live in the morning. If I go live tomorrow, it'd probably be at 9 a.m. 9 a.m. If there's interest, I'd do one at 9 a.m. tomorrow. I'm from the U.S. I'm definitely doing one. I'm definitely doing one at 7 p.m. But if there's interest, I will do one in the morning at 9 a.m. Eastern Standard Time. But again, these are all the books I've read from. Unfortunately, I've read them cover to cover, painfully. And then my lectures, I've read them slide 1 to slide 200. We should do in the morning too. Do we have a preference of what? So 7 p.m. Eastern Standard Time in Puerto Rico. We'll be back. Oh, hello from the U.S. to Puerto Rico. Cover to cover, yes. From slide 1 to slide 300, honestly. Is there what topics for tomorrow morning would we like to see? Tomorrow night is going to be nervous, cardiovascular, physiology. But is there any requests for tomorrow morning? How are you able to understand everything I've read cover to cover? The way that I study is, so for like anatomy things, like what and where things are, I've always used like flashcards and practice labeling. And then for physiology, respiratory, I can go over. Then for physiology, I always try to explain it out loud. So I'll read through my PowerPoint slides. I'm doing skeletal, bone, and cartilage right now, and in the integumentary system. Joint. This one specifically, I'll try to cover everybody a little bit. Integumentary. But practice explaining, like if you can explain, I dropped my pen. Like explain if you can explain blood flow through the heart out loud, or you can kind of like write it out and draw it out without looking at something, you know it. In undergrad, I made a lot of notes. In graduate school, I had the notes already, so I mostly spent my time focused on explaining things out loud. So I would read through. I read a lot of Gray's and Costanzo in grad school. So I would look at a topic and I would go, okay, like what are we learning about in like we're going through blood flow. And then in my notes, I would make the checklist of everything, and then I would look away and I would explain, but like, okay, like blood enters the right atrium from the superior and inferior vena cava, and it goes through, stuff like that. So that's how I have everything kind of pretty understood. Drawing things out too is definitely great. Were there any other questions here before I end the live, or are we all set? Do I prefer reading anatomy books or reading lectures? It depends. It's for depends on the textbook. On it, I honestly I kind of prefer the textbook mainly. I use lectures to narrow down. So like what I do is I will preview lecture slides. Can I do blood flow? Yes. We'll do blood flow tomorrow. Or do you want me to do blood flow now, real quick? What I remember is just practice going through the whole thing. Like, so, real quick. The way that I practice it very quick is you do 4 boxes. You can draw your kind of crappy heart. If you have different colors, use different colors, obviously. You have, let's see. You have right atria, right ventricle, left atria, and left ventricle. So blood enters the right atrium through the inferior and superior vena cava into the right ventricle, gets pumped to the lungs where it becomes oxygenated through the pulmonary artery away from the heart, back through the pulmonary vein into the left atria, and to the left ventricle where it is pumped out into the air to the rest of the body. How do you use flashcards to study? Normally I got digital, so what I would do is I would screenshot, like, I can't really show it, but I'll show real quick. I have screenshots of them without the answer. And then you go through and you just fill them in. Oh, and if you don't have digital ones, yay, AMP2, I'm back. Yeah, I know you were asking about some AMP2 stuff. We're going to do some AMP2 stuff tomorrow. Whitney, did you have any quick questions about AMP2 since we finished the questions? But that's a way to remember it. Like, just practice writing it out. Draw this out and everything. Like, draw your valves, pulmonary valve, aortic valve, things like that. But if you have physical ones, I always recommend, like, grabbing the flashcard and putting it up against a piece of paper, like putting it against a piece of paper and then labeling it. Or if you have a whiteboard and you want to use tape, you can put it on the whiteboard and do it like that, but just practice labeling. Alright, your thought. I'm struggling with the circular versus all these veins. What necessarily are you struggling with for it? Like, just information about them? Is it, like, labeling? Because labeling, I have to put something together for that. Can I go through heart embryology? Yeah, I can do that as well real quick. I'll probably do some just quick explanations because I do have to go here around noon. So let's get a blank sheet here. So circulation. You want O2 to the body and CO2 back to the heart, where it can go to the lungs and get excreted. So that's gas exchange. Arteries is away from heart. Veins toward heart. Location of it, labeling, yes. I've got that extra. Okay. I just recommend, I can show you kind of what I did. I do have this on my website as well. But I got a picture of this, and I practiced labeling all of these. So, but that study guide is on my website. So I would just very much practice going through and labeling where those arteries are and such. Then for heart embryology, I'll try to make this really quick. That's going to be the last question I take. So you have formation of a heart tube. Two is cardiac looping. Three is separation. Four is fetal circulation. Plus closure at birth. So in formation of the primitive heart tube, this is where heart develops from the mesoderm. So dev from mesoderm. And there's two endocardial tubes, and they form to so two endo form heart tube. Cardiac looping is essentially just what kind of like forms its S shape. So this is kind of what like positions like atria plus ventricles. Separation is where the atria and ventricles separate. And then at fetal circulation, this is where the foramen ovale closes, which becomes the fossa ovalis. I actually wrote a paper on heart embryology. Yes, you can find my website in my bio. I did love learning as a kid. For who asked that question? Jeez, my stupid. Catherine, did that help a little bit? I do have to go, but I can let you screenshot. This will be on my Instagram afterwards as well. Thank you. Yes, it did. Yeah, I can definitely maybe do a video on this if you send me an email, Catherine, on things that you need to go over for that. Because I wrote a paper in grad school and did research on heart embryology. So this is just a quick explanation of it, but I definitely know I have pretty extensive knowledge of heart embryology. How do I remember everything, even from flashcards? Practice labeling, practice with flashcards, practice explaining things out loud. That's the big thing. Amazing, thank you. Yeah, no problem. Again, all my study guides. Did I read about heart embryology and anatomy textbooks? No. I read about heart embryology from like scientific journals and such. So all that came from all my like grad school learning. Most of it came from like reading scientific journals, putting them together. Some of it's my own research. So some of that's just like, firsthand, like primary information that I found out just by doing research. So that's pretty cool. How do I focus when studying? I go into it with a to-do list. I go into it with a to-do list. Hold on, let me. So scientific journals are a great thing to look at outside of textbooks. I love reading scientific journals. How do I focus when studying? Again, big thing, phone away. 2, I always go into every study session with a to-do list of what like specific topics I want to cover. So it's like I have like, all right, I know what I want to do. Like I don't have to think about it, things like that. But anyway, if there weren't any other questions, I am going to end the live here. Again, thank you guys for watching. Thanks for following. My study guides are on my website. If you guys are interested in getting those, if you need some help making some notes, things like that. But if that's it, I'll be back again live, potentially tomorrow at 9 a.m., but definitely tomorrow at 7 p.m. Eastern Standard Time. Have a blessed day, Naomi. Good to see you again. Thanks for watching, everybody, and have a great rest of your day. Oop, I hit my stand again.